doubt that the world of local therapy has also emerged with like a lot of, it's flooded with different approaches. What's new?
Well, there are several new options. I would say in the area of ablation, we have novel forms of local therapy that use different energies. And for instance, the new kid on the block now is irreversible electroporation, which is a non-thermal technology. So there is going to be a much less risk of injury of any adjacent structures to the tumor. This is based on a current. Of course, we're speaking here about investigational device. Just to make it clear, this is not FDA approved for HCC or any other cancer.
Sure, sure.
In the area of let's say, drugs, we have trials ongoing with ablation enhancers. So drugs that will be released in situ during the ablation. Carriers that are thermally sensitive and therefore will be able to deliver a highly concentrated amount of drug in the ablation zone, ideally maximizing the efficacy.
So use the energy of the RFA to
Yes.
dissolve some membrane that will leach out some form of therapy
Correct.
at high maximal dose.
Correct.
Great, fascinating. What else?
That's in the area of ablation. In the area of chemoembolization, there are several new agents and drugs that are currently investigated. I mean, as I said, most of the procedures are still based on, drugs such as doxorubicin or cisplatin, and many new agents potentially have a profile that make them suitable for regional delivery.
But come on, fascinate us a little bit more. What about that virus that you can inject the vaccinia into the tumor? What's going on there?
That's probably, that's really very exciting. I would say is especially exciting because this would be the first locoregional therapy with a systemic effect. In short, this is an engineered, created virus from a vaccinia virus that we can inject into the tumor by using imaging guidance, similar to how we would do a biopsy. And then there will be an immune effect targeting not only the injected tumor, but any other foci of disease. This is one of the big trials that is now ongoing for advanced disease. So clearly, there are many new options under investigation. I would say that realizing how complex is the constellation of HCC, really this is a 360 approach trying to devise more effective and safe therapy.
It's fascinating. If anything, from the perspective of the medical oncologist, what you need to know at this point in time, that definitely these clinical trials are ongoing, but please make sure that you see what's around you, see what your colleagues might be doing, either at a close-by center or even at your own center sometimes, in regard to engaging patients with those clinical trials. We heard about electroporation. We heard about a thermal ablation with some leaching of certain therapy within the treatment based on RFA. We heard about the vaccinia, which I believe Dr. Lencioni is referring to, GX594 over here, which is a disrupted tyrosine kinase embedded within vaccinia that will actually induce the killing of the cells and transfecting all other tumors, being either in the liver or outside the liver. All fascinating stuff, but just make sure that you have access to those clinical trials. Richard.